Hi, this is Dr. Jeremiah Peck with Ally Academy Northwest, and welcome back to our video series on the National Counselor exam. In this video series, we're looking at the major content areas that populate the questions on the NCE. Namely, in this video, we're going to be looking at the helping relationship category. Now, we're going to break up this video actually into two parts. Part one being examining the theoretical orientations or the counseling theories that are involved in this section. And part two of this video is going to be examining the golden thread, treatment planning, and some of these theories in practice. The first theory umbrella that we're going to examine is what's referred to as the psychodynamic umbrella. Within this umbrella of theories, you have psychoanalytic, which is attributed to Freud. You have individual psychology, or sometimes referred to as Adlerian psychology, attributed to Alfred Adler. You have Jungian psychology. You'll also find attachment theory and some other modalities like object relations also involved with psychodynamic. A few basic tenets of psychodynamic as a counseling theory is it puts a great deal of emphasis on someone's past impacting the present. This is true for a variety of these psychodynamic theories where childhood trauma is examined or adverse childhood experiences, but not limited to difficult experiences, but it would look at someone's past as a whole as being a collection of formative experiences. Counselors who identify with a psychodynamic theoretical orientation will often encourage clients to explore their formative backgrounds, namely the experiences which shaped them, which influenced them, which taught them certain postures, beliefs, attitudes, and even behaviors that are impacting their present experience. One of the most impactful theories in the domain of psychodynamic was Freud's psychoanalytic. And in Freud's psychoanalytic theory, there are a variety of terms that are going to be exceedingly helpful for you to be aware of. One of those is Freud's whole concept in a term that he coined as defense mechanisms. Defense mechanisms have a variety of manifestations, including repression, projection, sublimation, rationalization, or suppression, which is basically denial. But you'll want to familiarize yourself with these various defense mechanisms as it relates to both psychoanalytic, which is Freud specific, but on the greater umbrella of psychodynamic theories as a whole. The development of defense mechanisms stem back to, it's theoretically suggested, someone's developmental experiences where now they are protecting some measure of hurt, some measure of arrested development, some measure of fear, worry, or internalized feeling of insecurity or inadequacy that is now manifesting in a unconscious or subconscious way in their present. In fact, this whole concept of the unconscious is a term you're going to see exceedingly in psychodynamic literature. Freud references the unconscious, as well as Jung and other psychodynamic influences reference the subconscious or the unconscious as well. It loans itself to this whole idea that someone's developmental experiences or their traumatic experiences have hardwired them in such a way that now they can have elements of their personality or their behavior or their compensation in different social circumstances that are established in ways that are not due to the present choices that they're making, but they are ways that it's falling below the awareness of the conscious actions of the person. It's also within psychodynamic theory that we see a lot of discussion on transference and countertransference. Now, this is likely going to be a concept that for the purposes of the NCE, you must be very familiar with. Transference are the feelings of the client as projected onto the counselor, or that the client experiences towards the counselor, and counter transference are the experiences that the counselor may have with respect back to the client. For instance, if the counselor reminds the client of a caregiver that they had in their childhood, that would be an example of the client experiencing transference towards the counselor. Now, if the counselor were looking at the client and the counselor were being reminded of their own child, and the counselor were to notice that they were developing parental experiences surrounding their interactions with the client, that would be an example of countertransference. Now, transference and countertransference aren't just concepts to be avoided in the clinical relationship, but instead ones that the counselor needs to be aware of in so much as they are impacting the therapeutic relationship. They can also be, according to psychodynamic theory, they can also be data points for further examining the relational or experiential or developmental origins of the client, as transference becomes a way of assessing how the client is projecting different experiences onto the counselor. Psychodynamic, as an umbrella of several different counseling theories, exists separately than from these other umbrellas we're going to be talking about as well. There's a whole other umbrella entailed in behaviorism. This is where you'll see folks like Watson or Skinner or Bandura. They would all sort of fall under this behaviorist category. Behaviorism is mostly governed by tenets of learning and reinforcements. You'll see concepts related to conditioning. That's the Pavlovian concept of classical conditioning. Skinner focused on operant conditioning, while Bandura focused on social learning, that behavior increases when someone sees something else get reinforced. So these theories, as they relate to counseling, look at behavior as something that is learned. When someone is experiencing something or acting in a certain way, they will look at that behavior being learned, and thus ways of overcoming that behavior or coping with that behavior can also be learned. This form of counseling will emphasize the client adopting new behaviors, being in new settings where these behaviors can be reinforced. In fact, the therapeutic relationship itself can serve as what is referred to as a corrective learning experience, where new behaviors can be modeled, can be encouraged, and can be reinforced through that positive affirmation cycle. Behaviorism also is separate from theories which fall under another umbrella, and that is humanism. Within humanism are a few different counseling theories. Most popular is that of Carl Rogers, Rogerian therapy, or sometimes referred to as client-centered therapy. Client-centered therapy, as well as most humanistic theories, tend to be fairly non-directive, whereas some other theories, namely cognitive theories or behavioral theories, or even psychodynamic theories, tend to be more so directive. Rogerian therapy is distinct in that, as a humanistic theory, it is rather non-directive. It places the expertise on the person of the client as opposed to the person of the counselor. Rogers suggests that there are 3 conditions of the person of the counselor to facilitate effective helping, and that is genuineness, empathy, and an unconditional positive regard. This is when the person of the counselor is able to reflect these 3 virtues to the experience of the client, and the corrective experience that happens for the client is that this genuineness, empathy, and positive regard results in the client experiencing congruence of their lived experience, as opposed to what Rogers suggests is incongruence in so much as incongruence is the foundation of the pathology that they might otherwise be experiencing. These theories are also distinct from another category that we're going to look at, and these are cognitive theories. Here's where you'll find names like Albert Ellis or Aaron Beck. There are a variety of theories that fall within the construct of cognitive theories. This could be Albert Ellis's rational emotive behavior therapy, or REBT. This could be more traditional cognitive therapy associated with Aaron Beck. But you'd also see here reality therapy could be considered a cognitive therapy as well. These therapies have to do with identifying thought patterns, identifying unhelpful thinking habits, identifying certain beliefs that the client has developed, not to say spiritual, religious, or faith beliefs, but beliefs about themselves, the world, and other people that are influencing their behavior. This theoretical disposition really believes that someone's behaviors are driven by the underlying cognitions that they have about themselves, others, or the world. Now, in addition to these camps, you'll also find Gestalt theory, transactional analysis, existential theory. Some multicultural counseling competencies also influence multicultural counseling. And there are systems counseling factors as well. Sometimes you'll see these referred to as systemic theories or family system theories, and they have a great deal to do with the interactional patterns between family members in a unit. I don't want you to discount the significance of systemic theories in regards to individual counseling. Some of the questions that you may encounter even in the NCE may look at the experience of an individual as it relates to a systemic theory, in so much that even individuals who come to therapy still operate within a system, and a systemic theory analyzes their system of origin or their system of operation and how that system is influencing or contributing to their experience of pathology. So family systems theory is not just for family counseling, and that's an important concept even to be aware of as it relates to the questions on the NCE. So I'd encourage you to take a look at these theories and really familiarize yourself not just with the theoretical orientation that you're most comfortable with, but to consider which of these perhaps you are not most comfortable with. Maybe you are more Rogerian and haven't looked into psychodynamic theories. Well, I would encourage you then, as this is a large section of the NCE, to focus in on the theories you are less familiar with. In the next video, part 2, we're going to be looking at the golden thread, treatment planning, as it relates to the application of these theories. Thank you so much for watching, and I'll see you in the next video.